Value-based contracting, primary care shortages, and increasing chronic illness call for an expanded role for pharmacists in clinical care. Additionally, pharmacists are struggling with lower reimbursements and frustrating DIR fees. That's why the two parties are linking up to offer care programs like chronic care management in order to help manage these conditions while generating revenue. In this video, we'll discuss how to implement a physician-pharmacist partnership, the initial steps needed to start a CCM program, as well as the duties assigned to each role for a successful partnership. Hi, this is JP from ThoroughCare. At ThoroughCare, we help providers and pharmacists manage Medicare programs like chronic care management with our care coordination software. While each CMS care management program has its own rules and regulations, the steps we'll discuss for implementation can apply to all of them. For this video, we'll use a chronic care management program as our example. So where should you start if you're looking to set up a partnership? As a pharmacist, the first step is to identify a qualified healthcare provider partnership. Because pharmacists cannot directly bill for CMS services under Part B, they must be billed under a recognized provider's NPI number. We suggest that you seek out a provider who accepts Medicare or other qualified insurances. Eligible practitioners include medical doctors, nurse practitioners, physician assistants, clinical nurse specialists, and certified nurse midwives. It's best to reach out to a local provider who you currently share patients with or already have an established relationship. Keep in mind that patients do not need to receive prescriptions at your pharmacy in order to receive CCM on behalf of the local provider. Once the provider-pharmacist relationship has been established, a provider agreement is strongly recommended. This agreement is necessary for CCM to be delivered through a community pharmacy on behalf of a QHP. A provider agreement outlines clear roles, responsibilities, negotiated rates, as well as billing processes and payment terms between the provider and the pharmacy. A provider agreement is not a collaborative practice agreement, as it does not expand the pharmacist's scope of practice. A CPA is suggested only if the pharmacist will expand their scope of practice. An example would be to allow the pharmacist to adjust medication. From here, there are a few areas that require collaboration, negotiation, and implementation for the specific care management program. First, software is crucial for CCM operations, communication, and oversight. Pharmacists may choose to use a physician's EHR, or they may utilize care coordination software like ThoroughCare to streamline the process. Technology can facilitate patient consent and enrollment, manage the entire CCM function, as well as simplify claim submission and documentation requirements. A software tool can provide oversight, time tracking, and coordination features, as well as provide clinical notes to the physician digitally or through their EHR integration. Second, the pharmacist should identify patients who would benefit from these services. Identified patients should be Medicare or dually eligible beneficiaries and must fit the specific program requirements. The pharmacist will also want to cross-reference the physician's patient list with their own customer list to find any overlap. Patients who already receive services from both may be more interested in a program's benefits. Now let's look at the distinct responsibilities that each party has in a CCM program partnership. As a qualified healthcare professional, duties include sharing the care plan with the pharmacist via fax, software, or electronic prescription from the EHR, billing insurances for CCM services, and compensating the pharmacist for billable CCM services. As the clinical staff member that provides CCM services, the pharmacist's duties include getting patient consent, verbally or written, to join the program, documenting the patient's consent, clinical notes, goals, and next steps from each patient within a software solution, EHR, or other digital medium that can be shared with the physician, overseeing the patient care plan, connecting with each patient for at least 20 minutes per month, providing appropriate feedback to the physician, managing appropriate pharmacy staff, including clinical staff, nurse practitioners, or physician's assistants. Lastly, the pharmacist must provide an invoice to the physician each month for agreed upon rates. Now that you have a better understanding of how physicians and pharmacists can partner to deliver care management programs, you might be interested in how care coordination software can help manage a program. Please contact us at the link below for more information. Thanks for watching. Please like and subscribe to our channel for more content like this. Bye.